Dr. Surani, he joins us live this morning. We discussed that monoclonal antibody earlier this week and how it's better suited for Omicron, but I'd like to talk about New Year's Eve celebrations. A lot of people will be out, and we're seeing the spread of Omicron right now here in the coastal bend, though not officially confirmed. What is your take as we move into this next wave of the pandemic, this next surge?
Good morning, John Thomas. I think we have mentioned very clearly it's not the question if, it's the question when. And, my gut feeling is it's already here. The challenge is that, again, a lot of the testings, we are not doing it because a lot of the folks have a very mild symptoms. They get better. Second thing is whenever we get the sample, we have to send it out for genomic testing. And the CDC labs runs behind, and it sometimes can take about a week or two before we get the results. We always runs about a couple of weeks behind the Houston, so we do expect some surge going on in the first and second week of January in coastal bend. The number will sure increase. We have seen the number of the patient getting admitted with COVID in hospital increase, but it's much lower compared to Delta. But again, we haven't seen the surge. So our best defense is offense, and best offense is prevention, and prevention is vaccine.
Right now, it's my understanding that when it comes to testing for COVID, there's difficulty with the current test detecting Omicron. What advice do you have for people that run out, because we're seeing it, people are lining up to get these COVID tests? Should they take the results with a grain of salt and maybe assume they have Omicron if they're experiencing some of the symptoms?
More than likely, I think if you're having a milder symptoms, you're having something like a runny nose, cold, scratchy throat, and you're positive, more than likely you have Omicron, because that's one of the most prevalent variant in the nation. And what we are going to be seeing is in this community is no different than anything else. The good thing is it's a much milder variant compared to the other one, but it's much more infectious than the previous variant. So in other words, if you get it, it's just going to spread to your friends, family, neighbors, and somebody is immunocompromised, or they are not vaccinated, or the kids who are not vaccinated, they can have a big challenges. So I think the best thing is that utilize the testing when it becomes more widely available. If you're doing a gathering indoor, make sure everyone is vaccinated, make sure that they do check before going into those events. So I think mask and physical distancing still remains our powerful ally besides the vaccination.
And Dr. Surani, with thousands of kids heading back to school next week here in the coastal bend, some parents might think, well, it's too late to get vaccinated for the start of next week. I'll just do it later. What advice do you have for kids 5 and older going to getting the vaccine?
I think it's never too late. You can always slow down the guards who are running in. You can put a defender. Even if they try to reach the goal point, you can slow them down till you can get some more help. And same thing is that vaccination, getting it, it's never too late. You don't know when it's going to hit. Try to wear the mask and keep some physical distancing, wash your hand, and get vaccinated. And, it's still not too late. Obviously, you should have done it earlier, but I think sooner the better. That will help you and your family, your neighbors, your friends, and community as well.
Dr. Surani, Happy New Year's to you. We thank you for all you have done for us this last year, for our viewers, for bringing in daily information that is the most current information out there and making us feel safer with the facts and not fear. Happy New Year's to you. We'll see you next year, sir. If you have a question for Dr. Surani, you're going to have to wait until 2022 to ask him. Well, no, we can get those questions to him today. Send us a text, 361-855-6397.